Could baby aspirin stop cancer in its tracks? The answer will shock you. What if cancer's deadliest trick isn't a gene mutation, but an invisible cloak? A disguise that lets cancer cells travel through your body, completely undetected by your immune system. What if these cellular fugitives, hell-bent on setting up deadly new colonies in distant organs, had a simple, common accomplice? For 25 years as a physician, I've seen the devastation of cancer. The first tumor is often manageable. But the moment it spreads, the moment it metastasizes, the game changes, and the fight for survival gets exponentially harder. That spread is the real killer. But what if we could disrupt that deadly journey? Today, we're going to explore a radical idea. That a simple pill, one you probably have in your medicine cabinet right now, could be the key to unmasking these hidden invaders and giving your body a fighting chance. The enemy we think we know. When we think about cancer, we usually picture a disease of uncontrolled growth. A single cell goes haywire, its genetic code gets corrupted, and it starts to divide again and again, forming a lump, a tumor. We focus on this primary site, and for good reason. It's the tangible enemy we can see on a scan, the one surgeons can cut out, oncologists can target with radiation, and that we can attack with chemotherapy. But here's a sobering truth. For most cancer patients, the primary tumor isn't what ultimately proves fatal. The real threat, the final act that accounts for the vast majority of cancer-related deaths, is a process called metastasis. Metastasis is a word that strikes fear into the heart of any patient, any family, any doctor. It means the cancer has spread. Those rebel cells from the original tumor have learned to break away, to embark on a perilous journey through the body, and to establish new, secondary tumors in vital organs like the lungs, the liver, the brain, or the bones. Think about the sheer audacity of this act. A cancer cell has to detach from its home, a community of billions of cells. Then it has to chew through the biological barriers that contain it and find its way into a blood vessel. And this is where the real mystery begins. The bloodstream should be a death trap for a cancer cell. It's a high-speed, turbulent highway patrolled relentlessly by our immune system. Specialized cells, like natural killer, NK cells, and T cells, are constantly on guard, their sole purpose to identify and destroy anything that looks abnormal. A rogue cancer cell floating alone should be an easy target. It should be identified and eliminated within minutes. And yet somehow, they survive. Somehow, these malignant cells complete a journey that should be impossible. How do they do it? How do they evade a multi-billion-dollar defense system that has evolved over millennia to do exactly this job? The answer, it turns out, is as ingenious as it is diabolical. They don't travel alone. They create a disguise. The invisible cloak, cancer's secret weapon. To understand this incredible act of cellular espionage, we need to appreciate our body's first responders, our platelets. You probably know platelets as the tiny parts of your blood that cause clotting. When you get a cut, platelets rush to the scene. They get activated, changing from smooth little discs into sticky, spiky spheres. They clump together, forming a plug that stops the bleeding. They are the paramedics of our circulatory system. But cancer, in its cunning evolution, has learned to corrupt these heroes. It turns them into unwitting accomplices. When a cancer cell breaks away from a tumor and enters the bloodstream, it sends out subtle signals that mimic a damaged blood vessel. The cancer cell is essentially crying wolf, tricking the body into thinking there's an injury. And who comes rushing to the rescue? The platelets. Within moments, a swarm of activated platelets surrounds the circulating tumor cell. They stick to its surface, piling on top of one another and forming a dense, protective shield. This is the invisible cloak. It's not just a metaphor. It's a physical barrier built from our own cells. This platelet shield is a masterpiece of deception. First, it's a physical disguise. Patrolling immune cells are looking for abnormal cancer cell surfaces, but they can't see them. All they see is a clump of normal platelets, which they're programmed to ignore. The cancer cell, hidden inside this Trojan horse, becomes invisible to the body's security forces. Second, this cloak is a suit of armor. The journey through the bloodstream is physically taxing, and the force of blood flow can tear cells apart. The platelet clump acts as a physical buffer, protecting the fragile cancer cell. Third, and perhaps most insidiously, the platelets don't just hide the cancer cell, they actively help it. When platelets become activated, they release a cocktail of potent chemicals known as growth factors, like TGF-V and PDGF. In a normal wound, these factors tell the surrounding tissues to grow and repair. But around a cancer cell, they do something far more sinister. They feed the cancer cell, sending its signals to divide, become more aggressive, and prepare for invasion. The platelets create a mobile life support system for the cancer cell, nurturing it on its journey. So, this cancer cell isn't a lone fugitive. It's traveling first class, wrapped in a protective and nurturing cocoon, completely hidden from the authorities. This platelet cancer cell clump tumbles along until it reaches a new spot, often in the tiny capillaries of a distant organ. There, the cloak's stickiness helps it to adhere to the vessel wall, and the growth factors it releases help it to burrow out and establish a deadly new colony, a metastasis. It's a devastatingly effective strategy, but what if there was a way to pull that cloak apart? The unmasking, a simple pill's surprising power. Enter one of the oldest, cheapest, and most common medicines in the world, aspirin. For over a century, we've used it to relieve pain, reduce fever, and fight inflammation. More recently, we discovered its remarkable ability to prevent blood clots, making it a cornerstone of cardiovascular medicine for preventing heart attacks and strokes. Its mechanism is elegantly simple. Aspirin works by inhibiting an enzyme called cyclooxygenase, or COX. For our story, its most important action is on platelets. Aspirin makes platelets less sticky. It reduces their ability to get those activation signals and clump together. This is why it's so good at preventing clots that can block arteries. For years, that was the main story. But then, researchers began noticing a curious pattern in large population studies. People taking daily low-dose aspirin for their heart seem to get certain types of cancer less often, especially colorectal cancer. And among patients who already had cancer, aspirin takers sometimes seemed to have better outcomes, with less metastatic spread. This begged a monumental question. Was this just a coincidence? Suddenly, the two stories, cancer's invisible cloak and aspirin's effect on platelets, collided. The logic was almost too simple to be true. If cancer cells build their invisibility cloak out of sticky platelets, and aspirin makes platelets less sticky, could this little pill unmask the cancer? The hypothesis was electrifying. By taking a daily low-dose aspirin, you could theoretically change the entire environment of the bloodstream. The platelets would still be there, but they'd be less trigger-happy and less likely to respond to the cancer cell's deceptive signals. They'd be less able to form that protective shield. Without its cloak, the circulating tumor cell would be naked and exposed. Its abnormal surface, once hidden, would now be visible to the immune system's patrols. The NK cells and T cells, no longer blinded, could finally do their job. They could recognize the cancer cell as an invader and destroy it before it ever had a chance to metastasize. It's a breathtaking concept. Aspirin doesn't act like chemotherapy. It doesn't kill the cancer cell directly. It acts as a saboteur. It disrupts the unholy alliance between the cancer cell and the platelet. It pulls off the disguise, leaving the enemy exposed for your own body to defeat. The question then becomes, is this beautiful theory supported by hard evidence? The evidence. What does the science actually say? This is where we move from compelling theory to clinical reality. The link between aspirin and cancer is one of the most intensely studied areas in oncology. The evidence is strongest for colorectal cancer. Many large, long-term observational studies have shown that regular aspirin use is associated with a significantly lower risk of developing colorectal cancer, often in the range of a 20% to 40% reduction. Now, it's important to know that this benefit isn't seen in all studies, and it seems to take time. Most research shows the protective effect only becomes significant after 5 to 10 years of continuous daily use. This makes sense. It's a long-term preventative strategy. The evidence is so compelling for certain high-risk groups that it has changed clinical recommendations. A prime example is Lynch syndrome, a hereditary condition that dramatically increases the lifetime risk of colorectal cancer. Major clinical trials like the KPP2 study have shown that daily aspirin can cut the incidence of colorectal cancer in these individuals. Based on this, many clinical guidelines now recommend that people with Lynch syndrome discuss taking daily aspirin with their doctors. Recent breakthroughs have been even more specific. For colorectal cancer patients whose tumors have a particular genetic mutation, known as a PIK3CA mutation, the results are stunning. A 2025 study reported at ASCO showed that taking aspirin after treatment could reduce the risk of the cancer coming back by over 50%. But what about other cancers? Here the picture is more complex. Some studies suggest a potential benefit for other gastrointestinal cancers, like esophageal and stomach cancer. Research into breast, prostate, and lung cancer is ongoing, but the evidence is less consistent. It's also crucial to understand that when you start taking aspirin matters. The Aspirin trial, which looked at starting aspirin in healthy adults over 70, found no benefit in cancer prevention and even hinted at potential harm. Long-term follow-up from that trial confirmed that starting aspirin late in life doesn't seem to reduce cancer risk. So, the science tells us the unmasking theory has real-world legs, especially for specific groups. This isn't a fringe idea. It's a scientifically validated concept that has already changed medical practice. But this potential must be weighed carefully against the very real risks. The reality check. This is not a miracle cure. This is the most important part of our conversation. It's easy to get carried away, so let me be absolutely clear. Aspirin is not a cure for cancer. It is not a replacement for standard treatments like surgery, chemotherapy, or radiation. If you have cancer, you must follow the plan from your oncologist. Thinking of aspirin as an alternative would be a tragic and life-threatening mistake. The research is focused on prevention and reducing recurrence risk, not treating active disease. Secondly, taking a daily aspirin has significant risks. The very thing that makes it useful, inhibiting platelet clotting, is also its biggest danger. The most serious side effect is bleeding, most commonly in the stomach or intestines. While often minor, this bleeding can be severe, lead to ulcers, and in some cases be life-threatening. The risk of bleeding increases with age. There's also an increased risk of a hemorrhagic or bleeding stroke. Because of these risks, the decision to take daily aspirin must be made with your doctor. It is a deeply personal medical calculation, weighing your individual risk of cancer and heart disease against your risk of bleeding. Your doctor will consider your age, family history, health status, and other medications. For a 45-year-old with a strong family history of colon cancer and low bleeding risk, the benefits might clearly outweigh the harms. For a 75-year-old with a history of stomach ulcers, the opposite is almost certainly true. There is no one-size-fits-all answer. In fact, the U.S. Preventive Services Task Force now recommends against starting daily aspirin for the primary prevention of cardiovascular disease in adults 60 and older, precisely because the bleeding risk starts to outweigh the benefits in that age group. Do not start taking daily aspirin on your own. This isn't a vitamin. It's a powerful drug that demands respect and expert guidance. We began with a simple question. Could a baby aspirin stop cancer in its tracks? The answer is a nuanced but hopeful maybe. It can't stop established cancer, but for some people, it may be a powerful tool in preventing cancer's most lethal move, the spread. The idea that we can disrupt metastasis not with a billion-dollar designer drug, but by repurposing one of the oldest medicines we have, is truly profound. By making our own platelets less sticky, we might just strip away the invisible cloak that tumor cells use to hide from our immune system. We empower our own bodies to do what they do best, protect us. The science, particularly for high-risk colorectal cancer groups, is compelling and has already changed the standard of care. But it's a strategy that requires long-term commitment and carries real risks, demanding a careful, personalized conversation with a healthcare professional. The future of cancer prevention won't be a single magic bullet. It will be a mosaic of strategies: better screening, healthier lifestyles, and the intelligent use of medicines, both new and old. The story of aspirin is a powerful reminder that sometimes a key to fighting our most complex diseases might just be hiding in plain sight. This information is for educational purposes only and is not a substitute for professional medical advice. Always speak with your doctor to discuss your individual health situation and before starting, stopping, or changing any medication regimen. If you found this deep dive valuable, please like this video and share it to help spread awareness about this incredible area of research. And subscribe for more videos that break down the science behind your health. Thank you for watching.